First, I want to thank you for taking the time to hear about this new project that affects children in our urban teaching hospital. My name is Emily Duman, and I'm excited to share this project with you all today. I hope you find the information presented to you deems this initiative one of the best ways to reduce healthcare costs quickly and improve the quality of patient care in the process is to implement changes that reduce hospital readmissions. Within 30 days or less, between 15 and 25% of people. Some of the most common reasons for readmission are preventable. Readmissions in the first two categories, complications and poorly managed transitions, usually occur within 15 to 30 days after leaving the hospital. Patients are categorized as having a poorly managed transition to home when they do not receive proper instruction regarding new medications, treatment plans, or information on what not to do while they recuperate from their latest admission. The largest volume of readmissions occurs among patients with chronic conditions such Asthma is the leading cause of pediatric hospitalization and readmission in the United States. Almost 150,000 children visit the emergency room each year for asthma-related symptoms, and up to 20% are admitted to either an intensive care unit or general care floor for further treatment and observation. The number of people in the United States diagnosed with asthma has increased 28% between 2001 and 2011. The costs associated with this disease in the United States in 2007 were $56 billion. $50 billion of this sum is considered a direct cost, which includes hospitalizations and medications. The remaining $6 billion accounts for the missed school and work days. Children suffering from asthma miss 3 times more school days each year. The days add up to more than 10 million each year when you take every asthmatic student into consideration. As the costs of asthma controller medications continue to rise, more children are competing with other family needs. The cost of these medications has increased almost 50% since 2009 alone. A recent study has shown that nearly 78% of children do not comply with their treatment recommendations. The average cost of a pediatric asthma admission was $4,000 in 2010. More than half of these children are covered under Medicaid, which will no longer pay if the patient is readmitted within a month. A study conducted by the University of Cincinnati Hospital in Ohio wanted to find out the reasoning behind such low compliance rates for pediatric asthma. They looked into a number of factors, such as patient and family factors, healthcare system factors, healthcare provider factors, and environmental factors. The study found that the 2 most common reasons for noncompliance related to parental attitude towards the disease and a lack of knowledge about pediatric patient-specific triggers and medication use. Guidelines issued by the National Asthma Education and Prevention Program say that the most essential components of asthma management are patient education, objective monitoring of symptoms, and avoiding asthma triggers. Healthy People conducted a survey back in 2010 and found that only an average of 19% of asthmatics receive care under these guidelines. The Centers for Disease Control and Prevention go even further to say that youths and adults with asthma lack the education necessary for effective self-management and control of asthma symptoms. When I was initially approached about this problem, it was obvious to see from the data presented that we had a need for patient education while they were admitted under our care. Our committed team of respiratory therapists already follow these asthma patients from the time they are in the emergency department up until the time they are on our general care floors. They are with the patients a minimum of every 4 hours, and sometimes even more frequently if they are requiring more support. They are the ones doing the respiratory assessment. The best part about respiratory therapists providing this education is that they are with the patients every few hours and can provide this education throughout the same time that they are admitted. Recognizing symptoms and avoiding triggers is a great way to help them understand their disease better. Not only should they know how to avoid animals or smoke, they should also know what happens to the lungs during an irritation that may lead to an asthma attack. This ties in with having a better understanding of their medications. Anyone can learn to grab a brown inhaler or a blue one when they are noticing symptoms. But even just having a basic understanding of why the brown one works for inflammation, while the blue one is for smooth muscle relaxation, can make all the difference. To improve medication deposition in the lungs, we will teach children how to properly use their spacers. They'll be able to get more out of their medications so they last longer, and also avoid using the rescue medications so frequently. The hope is that their new asthma action plan can include all of this written information into one document to include medication indications, what medications to take when peak flow meter measurements are within a certain range, and when to seek medical attention. By going over their new asthma action plan in-house and sending them home with multiple copies, they will be able to review these materials at home. It is also important to make sure to take these into school. The funding of credentialing a number of our respiratory therapists will allow us to use their expertise on the creation of asthma education materials according to the National Asthma Education and Prevention Guidelines. It would also give us a set group of committed professionals to help carry out the education necessary to reduce hospital readmissions for asthmatic patients. Since our therapists are already spending time with these patients, there is no need to hire more staff to carry out this initiative. The materials we provide to families will include educational pamphlets and personalized medication lists, peak flow meters for them to take home and use in conjunction with their asthma action plan, and a spacer to also take home with them to use with their metered dose inhalers. The Asthma Council will be formed with new asthma educator therapists to help update materials and meet every so often to discuss new ideas. Here is a list of the references used to support the information that I have presented to you. Thank you again for your time and consideration. Please feel free to ask any questions